deep brain stimulation, which is obviously one of the most successful treatments for severe dystonia. You are obviously one of the pioneers of the field, and along with Dr. Benabid, you paved the way towards the current use of DBS. How do you view DBS today after years of undeniable successes?
I think it's miraculous, and it remains that way every time we do it. It is transformative for many patients. I think there's been a lot of focus on Parkinson's. It was developed in the setting of Parkinson's disease. We were really working with the model of Parkinson's, and were able to show that by interrupting a circuit, a network that we had really identified within the basal ganglia that was important, and we knew a component of the pathway that was disturbed in Parkinson's, we were able to almost totally reverse the symptoms, tremor, the slowness of movement, and the stiffness, muscular rigidity. That opened the door to, or I guess again, to think and be willing to go back and try things that had been done in the previous century, when surgeons, without any available medications, were tried surgical approaches. And what I mean by that is going into specific, or identifying specific parts of the brain that are involved in motor control, motor function, and interrupting those pathways because they cause tremor or they cause symptoms and signs of Parkinson's. So we were able to identify a novel target really for those kinds of interventions. And there was a period of time that elapsed, but Alan Benabid is the person who discovered deep brain stimulation. In a sense, he discovered it because people had known about deep brain stimulation for a long period of time before that, but he took it forward as a way to stimulate chronically for movement disorders in a specific part of the brain that was important for tremor. And that's how deep brain stimulation was really, the current modern era of deep brain stimulation really came about because of a chance discovery, and he will tell you it was serendipitous. He just was stimulating in a patient with the electrode in the brain at a site where he was going to make a lesion. And rather than, he was actually surprised because when he stimulated at a high frequency, it stopped the tremor. And he was recognized that was one way, and it had actually been known before, but it hadn't been carefully studied. And Benabid took it forward and worked with industry to develop an implantable system, and those were becoming available for treatment. So that was an important discovery. Our contribution was this little specific part of the brain, the subthalamic nucleus, that turned out to be one of the best targets we have for Parkinson's. Yeah. And also works for dystonia. And the interesting thing is that the network, the pathways through the brain that are disturbed for Parkinson's are the same that are disturbed in many ways for dystonia. And almost, I begin to say sometimes jokingly that Parkinson's disease and dystonia are different, but they occupy the same pathways. They result from different disturbances within the circuit.
Right.
One kind of disturbance produces tremor or rigidity and slowness. The other one produces dystonia.